Switching gears a little bit now to the kids, Dr. Brown. We have a 4-year-old in our house, and it seems like she's always getting sick with some virus or another. And kids commonly, one thing I do recall is that kids commonly get all types of virus, whether it's rhinovirus, RSV, and different coronaviruses. Is the Delta variant and potentially other variants concerning as it pertains to children?
That's a great question. And certainly kids definitely get infected with COVID and lots of other common viruses. And right now we're seeing a ton of common viruses that we don't necessarily always see right at this time, like RSV. But certainly we've got entero, rhinovirus, adenovirus, a number of other what we call common cold viruses that kids are getting, and we're entering into flu season. But when it comes to the Delta variant, we certainly are seeing that we are seeing a big surge in children. And so the weekly rate is 10 times what it was in June. So the Delta variant has definitely made a big difference in terms of the number of children who are getting infected with COVID. And at the beginning of the pandemic, it was, commonly said that maybe kids didn't get it, maybe kids couldn't spread it. And we know 100% that they definitely can get it and they definitely can spread it. And certainly while acute COVID is something that we worry about, the acute infection with COVID, and about 1 to 2 children out of 100 will end up hospitalized, but it's very rare that a child will lose their life to acute COVID. Low risk certainly does not mean no risk. And then they can spread it while they're infected. And it's important for families to remember that kids with COVID mostly have no symptoms at all. And if they do have symptoms, they're very mild and they get better very quickly. So just like Dr. Gaffney was saying, it's absolutely crucial if your child has any one symptom on that list to make sure that you isolate and get them tested before you're back out. And of course, household contacts as well.
Sticking with the kids, you and I have talked about the pediatric age group. And as we had talked about before coming on, with the FDA having their discussion, but today it came out that Pfizer and biotech say that their vaccine trial for kids shows quote unquote promising results. What are your professional opinions regarding the COVID-19 vaccine for the pediatric age group, both for those over the age of 12 as well as those younger than the age of 12?
We are really excited, obviously, to have a vaccine for kids who are even younger than 12, but currently right now, it's only recommended for kids for 12 and up. And I think we have to wait until we see that data, right? And so it's great that they're encouraged and they think that it's safe and effective, but then we have to have due diligence, by the FDA and the CDC to make sure that that data is consistent. And I think that that's a really important step that, no one is going to skimp on. So certainly when we talk about safety bars, it has to be higher for children, it really should be, and it is. And so far we have seen, millions of children who are 12 and up get vaccinated and they've responded well to it. Their antibody levels are equal or higher to those who are adults, but we still need even more 12 to 17-year-olds to get vaccinated. So if you look in the US, only about 52% of 12 to 15-year-olds have gotten even just one dose, right? So we have a long way to go. And certainly those rates are going to vary depending on what state you're in. But certainly any vaccine can have side effects. No vaccine is going to be 100%. And these COVID vaccines have been shown to be very effective to all of the variants that we've seen so far here in the US.